What you see on the screen is a Persian illustration of the cardiovascular system made by the Dr. Mansur ibn Muhammad by the end of the 14th century. This one belongs to his treatise The Anatomy of Mansur, a present he gave to the Sultan Siya al-Din Pir Muhammad Bahadur, and it also constitutes the most ancient color atlas of anatomy of the Islamic world. This treaty is conformed by 40 manuscripts and is divided into 7 sections, one of which is dedicated to the venous vascular system and another one to the arterial one. As you see, painting was the only cardiac image technique available in ancient times, and in spite of how much the world has changed since, we, present cardiologists, keep drawing hearts. Hello, welcome to Cardio Flash College, a place to learn cardiology with flash animations. As you know, in this channel we try to represent with drawings the complex and fascinating world of the cardiology with the objective to ease the process of academic formation. However, we are not the first to do it, because the heart has been the object of study and devotion since the beginning of time. The visual perception of its beats and its unremovable connection with emotions have motivated the interest of an uncountable amount of people to unravel its mysteries and immortalize in an image its functioning. This is why these are 5 images: constrictive pericarditis. Number 1. As you know, constrictive pericarditis is a light complication of an acute pericardial process, and it is characterized by a thickening, fusion, and, many times, calcification of the pericardial sheaths, especially the parietal one. This translates into a loss of elasticity of the membrane that restricts the dilation of the cardiac cavities during the final phase of the diastolic fill, and that it manifests clinically as an acute right heart failure. As you see, pericardial calcification is the classical radiological sign of the constrictive pericarditis, but it appears only in 40% of the cases, so a normal chest X-ray does not discard this pathology. Number 2. The echocardiography constitutes a very useful tool in the study of the constrictive pericarditis. Sometimes a pericardial thickening can be detected, or, as in this case, a partial calcification of it. Using the M mode, the protodiastolic notch or septal rebound can be evident, while using the Doppler, respiratory variations generated by the ventricular interdependence can be identified. For example, as in this case, a decrease of more than 25% in the transmitral flow velocity with a deep inspiration. On its own part, the tissue Doppler usually reveals that the mitral annular velocity is conserved, showing an E prime superior to 0.8 meters per second. Finally, transthoracic echocardiography can show us an important dilation of the inferior vena cava and the suprahepatic veins. Number 3. Cardiac MRI is a great technique for studying the pericardium. Under normal conditions, pericardium measures less than 2 millimeters of diameter, and as you can see in this case, it is clearly thickened, which is frequent in patients with constrictive pericarditis. Moreover, it is interesting to point out that in this case, there is also a systolic cardiac anchoring, which can suggest the fusion of the visceral and parietal sheaths of the pericardium. Number 4. Cardiac CT scan is a useful tool in the study of the constrictive pericarditis because it constitutes a very sensitive diagnostic tool in cases of pericardial calcification. As you can see, in this case, calcium is especially abundant in the inferior portions of the pericardium, which can suppose a difficult challenge in an hypothetical surgical scenario. Number 5. Heart catheterization is an invasive technique that allows us not only to study coronary disease, but also to study the hemodynamic of the cardiac cavities. Let's begin with the left heart catheterization. As you can see, coronary arteries do not have significant lesions. However, the most interesting finding of this study is of course the severe circumferential calcification of the pericardium, an infrequent but pathognomonic finding. Regarding right heart catheterization, we can say that there are a number of classical physiological changes that we must know how to identify. These are, for example, a deep Y sinus in the venous pulse or in an atrial pressure register. On its own part, we see that diastolic pressures inside all cardiac chambers tend to be elevated and even, showing a difference smaller than 5 millimeters of mercury between telediastolic pressures of the right and the left ventricles. At this level, we can also appreciate the classical pattern in square root or deepened plateau. And finally, but not less important, we can find an opposite respirophasic behavior when we measure the pressures of both ventricles during deep inspiration. This is a reflex of the ventricular interdependence, and it can finally confirm the diagnosis of constrictive pericarditis. As you see, non-invasive cardiac imaging tests can be helpful in the study of the constrictive pericarditis. However, it is necessary to draw on heart catheterization in a non-negligible percentage of cases. In any case, it is relevant to dispose of all information necessary to be able to identify constrictive pericarditis without mistaking it with other entities, such as the restrictive cardiomyopathy. As you can imagine, this topic can give a lot to talk about, but we do not have more time to continue. It has been all for today in Cardio Flash College. We hope you liked the video. If so, subscribe to the channel and leave a like. We'll see you in the next class. And remember, don't come late. Bye.